That diagnosing pyelonephritis in cats is often difficult. While we recognize this disease as a significant cause of acute worsening of chronic kidney problems, the typical signs we look for can be vague and not always present. These signs might include fever, elevated kidney values in blood tests known as azotemia, the presence of bacteria in urine, pain upon abdominal examination, and an increased number of neutrophils, a type of white blood cell. We might also see abnormalities on ultrasound, such as a widening of the renal pelvis, the central collecting area of the kidney. However, the researchers point out that these indicators can be unreliable and not specific to pyelonephritis. Currently, the most definitive way to diagnose this kidney infection involves a procedure called ultrasound-guided pyelocentesis. This is an invasive technique where a needle is guided by ultrasound to collect urine directly from the renal pelvis for analysis and bacterial culture. This method requires a skilled operator and is not always possible, especially if the renal pelvis is not sufficiently dilated. In human medicine, the presence of fever alongside a clinical diagnosis of a urinary tract infection is a strong indicator of pyelonephritis, as fever is less common in simple bladder infections. Similarly, elevated white blood cell counts or increased levels of a protein called C-reactive protein in the blood can suggest a kidney infection in humans. The study authors emphasize that accurately diagnosing bacterial pyelonephritis in veterinary medicine is crucial because it has significant implications for how we treat the animal and what the likely outcome will be. They then introduce a group of proteins known as positive acute phase proteins. These are substances whose concentration in the blood increases when there is inflammation in the body. One such protein, called serum amyloid (SAA), has been gaining attention in veterinary medicine. Increased levels of SAA have been linked to various inflammatory, infectious, or cancerous processes. In human medicine, other acute phase proteins like C-reactive protein and procalcitonin have been investigated for their role in diagnosing bacterial pyelonephritis. Some research in children suggests that low levels of C-reactive protein might help rule out a kidney infection, but high levels are not specific enough to confirm it. Their study demonstrates that serum amyloid A concentration is significantly higher in cats with confirmed or presumed bacterial pyelonephritis, and that measuring SAA using a threshold of 51.3 mg per liter appears to be sensitive for diagnosing this condition, potentially serving as a useful test to rule out pyelonephritis when the suspicion is low. However, they caution that SAA is not specific for bacterial pyelonephritis and can be elevated due to other inflammatory conditions.